Introduction myself. My name is Ulil Wafa Khoirul Started number 2131000195. In her, I will presentation English journal international by title overview of artificial intelligence in medicine. Structural of international journal. Number one, abstract, introduction, methods, result and discussion, conclusion, and reference. Capture abstract. Artificial intelligence AI is the term used to describe the use of computer and technology to simulate intelligent behavior and critical thinking comparable to human being. John McCarthy first described the term AI in 1956 is the scale engineering of making intelligent machine. The objective to describe article give a broad overview of AI in medicine dealing with the term and concept as well as the current and future application of AI. It aims to develop knowledge and familiarity all of AI among primary care physicians. The next introduction. Alan Turing was one of the founder of modern computer and AI. The Turing test is based on the fact that the intelligent behavior of computer is the ability to achieve human-level performance in a cognition-related tasks. AI in medicine can be dichotomized into subtypes, virtual and physical. The virtual part ranges from applications such as electronic health record system to neural network-based. The best of evidence-based medicine is to establish clinical correlation and insight via developing association and pattern from the existing database of information. This requires feeding a large amount of data into machine-based cloud network considering the wide range of symptoms and disease process and encountered in routine medical practice. The outcome of this approach are limited because the machines are not able to absorb and gather quiz which can only be observed by a doctor during the patient encounter. In the capstone material and method, PubMed and Google search were performed using the keyword artificial intelligence. Further reference were obtained by cross-referencing the key article. An overview of different applications utilizing AI technologies currently in use or in development is described. Currently in use or in development is described. And the result in presentation, a lot of AI is already being utilized in the medical field, ranging from online scheduling of appointment, online check-in in medical center, digitization of medical record, reminder call from follow-up appointment and immunization date for children and pregnant females to drug the shock algorithm and adverse effect warning will prescribing multi-drug combination. AI could provide substantial aid in radiology by not only labeling abnormal exam but also by identifying quick negative exam in computer tomography, X-ray, magnetic resonance images, especially in high volume setting and in hospital with least available human resource. In the capture discussion, AI is growing into the public health sector and is going to have a major impact on every aspect of primary care. AI-enabled computer application will help primary care practitioners to better identify patients who require extra attention and provide personalized protocol for each individual. Primary care physicians can use AI to take their notes, analyze their discussion with patients, and enter required information directly on into EHR system. A study conducted in 2060 found that physicians spend 27% of their office day on direct clinical face time with their patient and spend 49% of their office day on electronic hospital record and disk work. When in the examination room with patient, physicians spend for 52% of their time on EHR and other work. The increased utilization of technology has reduced the number of job opportunities, which many doctors in the making and practicing doctor are concerned about. Analytically and logically, machine may be able to translate human behavior, but certain human traits such as critical thinking, interpersonal and communication skill, emotional intelligence, and creativity cannot be honed by state machine. Conclusion: AI promise to challenge the practical of medicine in here to ways, but many of its practical applications are still in their infancy and need to be explored and developed better. Medical professionals also need to understand and assimilate themselves with this advance for better healthcare delivery to the masses. The goal should be to strike a delicate, mutually beneficial balance between effective use of automation and AI and the human strength and judgment of trained primary care physicians. In the last chapter references. These references from several related journals obtained through PubMed and Google search using the keyword artificial intelligence, which is the attached to the original journal. That's all I can say. If there are mistakes in detail, please forgive me. Wassalamualaikum warahmatullahi wabarakatuh.